Hi, my name is Amir Lebastchi. I'm a urologist at the University of Southern California in Los Angeles. High-intensity focused ultrasound, or HIFU, is an energy modality, a non-invasive treatment for prostate cancer. It uses the temperature extreme of heat to treat prostate cancer cells in the prostate in patients who are diagnosed with prostate cancer. So there are different ways of focal therapy. HIFU uses a transrectal approach. We use a probe that is inserted into the patient's rectum. This probe creates high-intensity ultrasound waves that basically increase the temperature within the prostate and ultimately kills the cancer using a transrectal approach. It's different than the other treatment modalities, including IRE, laser ablation, or cryotherapy, which uses a transperineal approach where we have to insert needles into the patient's perineum. So I think these treatment modalities are complementary. I think HIFU has the advantage of addressing cancers in the posterior zone of the prostate better than the transperineal treatment modalities, because the ultrasound probe is right in the rectum, just below the cancer, while the transperineal treatment modalities can be very effective in patients with anterior tumors. So HIFU is in general a very safe procedure. The side effects are mostly urinary retention or urinary tract infections, but there are some, in the literature, there's some reports of fistulas that have been reduced with the newer HIFU modalities. After HIFU, a patient has a catheter in place for 3 to 5 days. The catheter is going to be removed. It's an outpatient procedure. The patient comes in. It's a 2-3 hour procedure, going to be discharged right after HIFU, and comes back in 3 to 5 days for a voiding trial where we remove the Foley catheter. We have adjusted our treatment and have now more recently even better success rate. Traditionally, the treatment failure rate is reported between 20 to 30%, meaning the chances of you have remaining cancer in someone who was treated with HIFU was 20 to 30%. Now we're adjusting our technique a little bit, and by providing something like double tap or boost HIFU, we further increase the chances of recurrence rates in the treatment zones. I like to say we don't burn any bridges. You can have another set of focal therapy, you can use a different focal therapy modality, or again HIFU, or we can go with whole gland treatment options, including radical prostatectomy or radiation therapy.